So dyslipidemia is basically a problem in which there's unhealthy levels of cholesterol in blood. There's different types of cholesterol. There's the LDL and the triglycerides, which are bad cholesterol, and there's the HDL, which is a good cholesterol. Now, when you accumulate higher levels of this LDL or triglycerides, which are the bad cholesterol, this is actually what forms the cholesterol plaque, which ends up sticking to the vessels and obstructing them, causing disease like a heart attack or a stroke. Dyslipidemia is very important to address since actually you're young. People think that this is something that only happens to older people, but you can actually see people at their 20s having dyslipidemia. Now, when you accumulate plaque in the vessels, this is not a process that happens in 1 or 2 days. This takes 10 to 15 years. So that's why it's so important. When people have a stroke at 55, it's because since they were in their 40s or even 30s, they're already accumulating plaque because they have these unhealthy levels of cholesterol. If we can assess this, if we get the testing at the right moment and we can treat it appropriately with changing diet, exercise, and if necessary use of medications, we can prevent the formation of this cholesterol plaque and avoid someone have later on a complication, as I said, a stroke or a heart attack later on. You may have elevated cholesterol levels and not even be aware at all. So that's why it's important after you are an adult, especially after 21 years old, at least have routine checks up once a year, every 2 years. Make sure your cholesterol level is well controlled. And then if it's not, then depending on your age, you will have certain ways to control it, rather with exercise, diet, or with medication if needed, before you present symptoms. The way I try to explain this to my patients is basically put in simple terms. Explain them that the vessels is basically like a pipe, and if that pipe gets clogged, eventually it's going to obstruct the flow. Now, whatever we do now is going to impact what's going to happen in 10, 15 years. If we avoid now by changing lifestyle, by changing diet, or if needed medications to avoid that clog to grow, is going to keep them from having a complication later on. We have very clear guidelines in which the American Heart Association and American College of Cardiology has recommended when to treat, how to treat, who needs to be treated. We cardiologists, we are experts on this, and that's why we can provide the best care to any person who has dyslipidemia.